Hi everyone, my name is Dr. David Kulla. Today we're here to talk about Osgood Schlatter's disease. So it's a common disease that we see with growing adolescents. You know, when your bones are still growing, the growth plates are growing, it's common to see this with kids that are athletic and typically affects the muscles, tendons, and the bones. And right here we have Priscilla here with Osgood Schlatter's. She's obviously no longer a teen right now, and it does sometimes bother her. So we've given her orthotics for her feet to balance that out, to take some of the stress off. But this doesn't just have to happen to teens that are athletes. It can also happen to sedentary, non-athletic teens. And typically, if your kid is not athletic and not involved in a lot of jumping or running sports, then you're going to see that it's probably coming from something else, that extra stress. It could be extra weight. It could be also flat feet. And I've done some videos on flat feet and how to get the feet assessed. Done so many videos on that, from exercises to how to assess the feet. So we did have to get her orthotics. Were you an athlete when you were younger? Running and jumping sports?
Yes.
Yeah? Okay. So again, it's when you're growing, those years like 13 to 16, a little bit older for boys, but that's typically when we see it. And some of the symptoms are going to be pain, swelling when you kneel, or just with walking or going up and down stairs. And what happens is the pain is right here. And if we go ahead and zoom in to this spot right here, we can see this little tubercle, this little bump right here. Okay, and right here I'm treating her knee, by the way, with laser. We'll go over that in a second. So this little bump right here is where the tendon underneath the patella, the kneecap, attaches. And that tibial bone runs down here on the inside of your leg and shin here, and then stops right about here at the ankle. So a lot can be done. The tibial bone can be adjusted, but also, more importantly, it could be an issue with the ankle or flat feet or both, okay, or a multitude of things. Just depends on what kind of athlete they were, what kind of injuries they had. So some of the things you can do to treat it are NSAIDs, so ibuprofen, naproxen, Advil, aspirin, over-the-counter stuff, or you can ice it a lot, several times throughout the day, and also do some physical therapy or see a chiropractor for some stretches and exercises. If it's still bothering you though, this is a great way to reduce that inflammation locally, and it's called cold laser therapy. And as you can see, we're putting it right over the tubercle, and this helps her immensely with swelling or pain if she aggravates it, or sometimes like hiking or mountain climbing and hiking trails up and down. After a while, this will affect her knee, and this is a great way to do that. But also, I always recommend before doing any kind of exercise like that, if you have Osgood Schlatter's, that you do stretches and exercises. So, thanks for tuning in. Appreciate you. If you have any questions or comments, make sure to comment below. And don't forget to hit that like button and subscribe. Thanks again.